I'm going to try to explain how to pick your healthcare insurance plan under 3 minutes. Please go and research everything that I say. Please don't just go based off of what I am giving you as a person that worked in the field. How to choose your health insurance plan is based off your particular lifestyle. If you are a person that goes to the doctor frequently, I want to highly encourage, and before you pick a carrier, before you pick a plan, especially through the ACA, contact those doctors, contact those specialists, and make sure that they accept those plans. That way you're not losing money because you purchased a plan that none of your doctors accept. There's over 20 type of health insurance plans. I'm just going to go over the few that most people know about. There's HMO, PPO, EPO, Medicaid, Medicare, catastrophic, HSA, which is health savings account, and then there's also the backup plan, which is your dollars, your personal savings account. If you have an employer that offers healthcare insurance, it's actually a little bit cheaper compared to Affordable Care Act, depending on the size of your family. So if you have a super huge family, it may be beneficial for you to look at your healthcare insurance plan and go from there. The biggest difference between HMO and PPO, HMO is usually a little bit less per month versus PPO. And then HMO, you have to get a referral from your primary care before you could go to a specialist, versus a PPO, you don't need a referral from your primary care. So if you know what kind of specialist you're supposed to go to, you can just go directly to them. PPO history have shown actually have a bigger network of in-network providers. That's another thing to look at as well. Now, the biggest things to look at if you're a person that goes to the doctor a lot, or if your family goes to the doctor a lot, is your out-of-pocket costs. Your out-of-pocket costs, meaning your copay, your co-insurance, and then your out-of-pocket max, and also your deductibles. Other things to look at is your blood work, x-rays, EKG, outpatient stays, urgent care, and surgical centers. The other thing to pay attention is, what does your plan cover? What does your plan cover in network? Meaning their network of providers that they said that it's okay for you to go to. Remember, everything cannot be done inside of a doctor's office. So if you're going to a doctor and they like to send you all over town to do all type of services, then you got to pay attention to your co-insurance, and you need to pay attention to your deductible. The deductible is the set amount of what you pay out of pocket before your health insurance kicks in and start paying a portion of it. Your out of pocket is the cap of what you pay of covered health services for that year before your health insurance cover 100% of it. Your out of pocket does not include your monthly premiums. It doesn't include if you go to an out-of-network provider or you get an out-of-health plan service, like something that's not covered by your health plan. That doesn't go towards your out-of-pocket. Now, unfortunately, because you have health insurance, if you select health insurance, they will not negotiate any rates for you. The only time you can negotiate any type of rates is when you don't have any health insurance and you are self-insured, meaning your own money is paying for it. So a lot of self-employed people, what they like to do is get like a catastrophic plan or a high deductible plan and coop it up with an HSA so that they're able to kind of negotiate their rates. But even then, it's a lot of the way the system was set up was for the insurance. So in order to put it back into your hand is A, you got to do better with your health. B, you got to look at what you eat. And C, you got to put money aside so that you can be able to negotiate those rates directly with those providers. The last thing that I will say is, a lot of times what people mess up on is because they look at the health plan premiums monthly and then they don't necessarily look at what the health insurance cover. So basically what happens is they're paying for health insurance that basically don't cover anything. And then because they did not contact their providers and their specialists to make sure that they accept those insurances, they end up getting duped that way. Please don't respond to me if I'm saying any terms out of correct. It's been a minute since I've really just kind of dealt with the health insurance scene. Like I said, go back to research a lot of these things that I'm telling you. And as always, look at your costs overall versus the services that you are going to get. If you really don't go to the doctor like that, look to see if your finances could just take the hit in getting fined that you don't have insurance, and you could just pay for health insurance. You could pay for those doctor visits out of pocket. But if you're a person that, or you're a family that y'all go to the doctors constantly, again, I'm gonna stress it to you. Do not pay attention to their monthly premiums that much. Pay attention to what do they cover after you pay your deductible, after you pay your co-insurance, and then your out-of-pocket max. Look at in-network versus out-of-network. Happy hunting, guys. Oh, and I'm not going to do this again.